all the confusing terms. That is, in scapula you get processus coracoideus. Okay, processus coracoideus. In clavicle, from the smooth surface in the left side, so this is from the upper surface, smooth surface on the left side, so this is left sinister clavicle. Here is the processus conoideus. And here in humor, from the medial margo, the bigger one hole, that is fossa coronoideus. Okay, attaching to this in the ulna we have processus coronoideus. This is processus coronoideus. Let's revise the processes again. Processus coracoideus, okay, in scapula. Processus conoideus in clavicle. Processus coronoideus in ulna. Attaching to this in humor, in the front surface, in the medial margo layer, the bigger fossa, that is this one, is fossa coronoideus. Coronoideus comes in humerus and in ulna, coronoideus, but this is the fossa coronoideus, that is processus coronoideus. Thank you. This is the ulna and this is radius. Let's study the similar parts. This is the caput radii, but whereas for ulna, this is the caput ulna. Okay, both have processus styloideus. Both have tuberositas. Tuberositas ulna, tuberositas radii. Okay, both have margo introsius, the sharp one. Okay, margo introsius. And then I'll say fascius anterior, fascius posterior, margo posterior, margo introsius, margo posterior, fascius posterior, and fascius lateralis. The processus styloideus carries the fascius lateralis. Okay, here this is margo introsius. This is fascius anterior. This is fascius posterior. This is margo posterior and this is fascius medialis. You may think this is fascius backside, so but how is it medialis? Because this is tending towards inside the body, so this is margo medialis, and whereas this is margo lateralis. Okay, margo medialis, margo lateralis. Let's do again. Margo introsius, fascius anterior, margo anterior, fascius medialis, margo posterior, fascius posterior. Fascius anterior divided by margo introsius. Fascius anterior, fascius posterior divided by margo introsius. It's a little bit ulta-pulta if you can manage it out, and both of them are left. How to identify if it's left or right? Take the bone, hold it in this is posterior and lateral surface view. If processus styloideus is in the left, then this is left. And for this, hold it in the anterior view. If this incisura radialis, this is incisura radialis, and there's like a small outcome on the outside. If this is in the right, then this is left. This thing. How to identify if this radius is left or right? Just hold it like this, just like I taught you, the foot thing in the front. And if this processus styloideus is tending towards the left, in this case it's tending towards the left, as you can see. If it's tending towards the left, it is left radii. It is sinister radii. That's it. Very easy. Okay. If it's coming towards this side, the processus styloideus, hold it like this, the foot thing in the front, but this is not the front surface. Okay, so hold this processus styloideus in the front with the foot thing in the front, and this, if it's going in the left, this is tending towards the left, so this is sinister radii. If it's going towards the right, then it will be dexter, but this is sinister radii.